This is the incidence of opioid overdoses in motor vehicles in Connecticut. I'm Suzanne Doyon. We have no conflicts of interest and no financial disclosures. 70,000 Americans died from overdoses in 2017. We're in the middle of a pandemic. This amounts to 130 overdose deaths per day and 3 overdose deaths per day in the state of Connecticut. We sought to find out where do opioid overdoses occur, and there was a study from Maryland looking at this, and that determined that 80% or so occurred in the home and only 5% occurred in motor vehicles. So we sought out to answer the questions: how many persons overdose in motor vehicles in Connecticut, and how many persons overdose in a motor vehicle that is moving? We took advantage of the SWORD program, which requires that EMS providers to report suspected overdoses to the Poison Center. It's a statewide program that covers a population of 3.6 million people, 31 acute care hospitals. And all EMS companies participate and are mandated to report motor vehicle information starting August 1st, 2019. The reporting occurs 24/7. So EMS takes care of the patient at the scene, and once the immediate life-threatening issues have resolved, EMS calls in the case to the Poison Center, where a series of 10 questions or so are asked and the answers collected in the electronic record. We performed a retrospective chart review of electronic records at the Poison Center starting August 1st to December 31st, a period of 5 months. The inclusion criteria were all SWORD events. Definitions: a motor vehicle was defined as a person at the wheel of a car. Moving was defined as the person in the motor vehicle, and the motor vehicle being engaged in drive as far as the transmission is concerned. So over this 5-month period, we collected overdose information on 2,078 events or so. That's about 14 overdoses per day. That's different than our overdose death, because not every overdose results in death. 1,868 were not involving or not in a motor vehicle, but 210, about 10%, did occur in a motor vehicle. And naloxone was administered to 84% or so of these overdoses. Of the 210 overdoses that occurred in motor vehicle, 105 occurred when the motor vehicle's transmission was engaged in drive, in other words, was moving. 41 actually involved a motor vehicle collision, and 4 had motor vehicle collision-associated severe injuries. So the strengths of this paper: it's a prospective data collection. It includes all the overdoses over a 5-month period. It covered the entire state, and it was capable of distinguishing moving from stationary vehicles. Limitations: not all cases are called into the Poison Center, and sometimes the overdose wasn't recognized at the scene of an accident. We also could not distinguish a true opioid overdose from an overdose that involved other substances or even alcohol. In conclusion, 10.1% of suspected opioid overdoses occur in vehicles, and that's different than previously reported, which was 5%. Half of these overdoses, or the overdoses that occur in motor vehicles, occur when the motor vehicle is actually moving. The public health implications of these findings are far-reaching. Police officers responding to motor vehicle crashes should carry naloxone, and longer longitudinal study with logistic regression would better ascertain the risks and the associated risk factors. Thank you.